Hello and welcome. Today, we're diving into a rare and fascinating neurological disorder called Opsoclonus-Myoclonus syndrome, or OMS. Often affecting children, OMS presents a complex challenge for diagnosis and treatment. We'll explore its origins, what happens in the brain, how it presents, and the approaches used to manage it. Join us as we unravel the mysteries of Opsoclonus-Myoclonus syndrome. The underlying causes of OMS are varied and not always fully understood. In children, it's frequently associated with a neuroblastoma, a type of cancerous tumor that develops from immature nerve cells, though not all children with neuroblastoma develop OMS and vice versa. In adults, OMS can be a paraneoplastic syndrome, meaning it's triggered by the immune system's response to a cancer elsewhere in the body, often lung cancer or breast cancer. However, OMS can also be idiopathic, meaning it occurs without any identifiable underlying cause. In rare cases, infections or exposure to certain medications have been implicated. The precise mechanisms behind OMS are complex and still being researched, but it's believed to be an autoimmune disorder. Essentially, the body's immune system mistakenly attacks healthy nerve cells, particularly those in the cerebellum and brainstem. These areas are crucial for coordinating movement and controlling eye movements. This immune attack disrupts the normal function of these regions, leading to the characteristic symptoms of OMS. The exact antigens or triggers that initiate this autoimmune response are not fully known in all cases. OMS is a rare condition. Due to its rarity, precise epidemiological data is limited. Studies suggest that the incidence is about 1 to 3 cases per million people per year. It's more commonly diagnosed in children, particularly those under the age of 4, although it can occur in adults as well. Because it can be associated with neuroblastoma in children, the incidence of OMS can fluctuate depending on the prevalence of neuroblastoma in a given population. The hallmark symptoms of OMS are, as the name suggests, opsoclonus and myoclonus. Opsoclonus refers to rapid, involuntary, multi-directional eye movements, often described as dancing eyes. Myoclonus involves brief, involuntary muscle jerks or twitches. These symptoms are often accompanied by ataxia, which is a lack of coordination and balance. Affected individuals may also exhibit irritability, sleep disturbances, speech difficulties, and developmental regression in children. The severity of these symptoms can vary greatly from person to person. Diagnosing OMS can be challenging due to its rarity and the similarity of its symptoms to other neurological disorders. Diagnosis typically involves a thorough neurological examination to assess motor skills, coordination, and eye movements. An EEG, or electroencephalogram, may be performed to look for abnormalities in brain activity. MRI, or magnetic resonance imaging, of the brain can help rule out other conditions and assess for any structural abnormalities. Blood and cerebrospinal fluid tests are crucial to look for antibodies associated with OMS and to rule out infections. In children, screening for neuroblastoma is essential, typically involving urine tests and imaging studies. A positive diagnosis requires careful consideration of the clinical presentation and supporting investigations. While there aren't distinct classifications or types of OMS in the same way as some other diseases, it's important to distinguish between cases associated with an underlying cause, like neuroblastoma or paraneoplastic syndrome, and those that are idiopathic. Identifying the underlying cause is crucial for targeted treatment. Treatment for OMS is focused on suppressing the immune system and, if present, treating any underlying cause. First-line treatments often include corticosteroids, such as prednisone to reduce inflammation and dampen the immune response. Intravenous immunoglobulin, or IVIG, which provides healthy antibodies to help regulate the immune system, is also commonly used. In some cases, other immunosuppressant drugs, such as cyclophosphamide or rituximab, may be considered. If neuroblastoma is present, treatment will involve surgery, chemotherapy, and potentially radiation therapy. Physical therapy, occupational therapy, and speech therapy can help manage the symptoms and improve functional abilities. The specific treatment plan will be tailored to the individual's age, severity of symptoms, and any underlying causes. Currently, there are no proven strategies to completely prevent OMS. However, prompt diagnosis and treatment of underlying conditions, such as neuroblastoma, may reduce the risk of developing OMS in susceptible individuals. In cases where OMS is idiopathic, prevention is not possible. Early recognition of symptoms and seeking medical attention are crucial for improving outcomes. The prognosis for OMS varies depending on the underlying cause, the severity of symptoms, and the response to treatment. Early diagnosis and aggressive treatment are associated with better outcomes, particularly in children with neuroblastoma. Some individuals may experience a complete recovery, while others may have residual neurological deficits. Recent research is focused on identifying specific antibodies and immune mechanisms involved in OMS, which could lead to more targeted and effective therapies. Researchers are also exploring the use of novel immunomodulatory agents to improve outcomes and reduce long-term complications. Further research is needed to fully understand the complexities of OMS and develop more effective treatments. Thank you for joining us on this exploration of Opsoclonus-Myoclonus syndrome.